Thank you very much, Prof, for joining us. So we're all excited because international travel is opened, but there are some very serious health concerns, some very serious hotspots that we simply cannot ignore. And what the President said about what's going on in Nelson Mandela Bay in particular must be keeping people like yourself up at night.
Yes, good evening, Sally. I think we heard a very clear message in that regard. I think the President started off by explaining that we are in a global crisis, that at a level that we've never seen before. We have almost 1 million infections every day. So in the midst of all of this, in South Africa, our epidemic has stabilized. We have a pretty low level of transmission through most of the country. However, that situation is being threatened by two clear things that he outlined. The first is this resurgence that we are seeing in the Eastern Cape, and the second is the potential for the December vacation to lead into a situation that could potentially put us at risk again. So I think that was his message to us. We've done well, we are in a good position, but we have to be ever ready and ever present regarding the potential risks that we have. And at this point, specifically, that is around the Eastern Cape and the situation that is going to come forward in the vacation.
Is there a plan, Prof, to deal with those possible risks? The President mentioned this resurgence plan where you'd have primary health care strengthened, you'll have outreach teams into communities, contact tracing. He's indicated that they're also monitoring some areas of concern that are experiencing higher than average rates. Those are areas like Mangaung, the Cape Town Metro, the Garden Route as well. So in an instance where you see that these areas are experiencing this higher than average rate, what do you do then without implementing harder restrictions?
So we have a very clear approach in the resurgence plan. It's mapped out very clearly, and the President has articulated some aspects of that. But it boils down to three key things. And the first is that we have to ensure that our health systems are able to cope. So ensuring the field hospitals are operational, there's enough oxygen supply, and so on. So there's a sort of basic medical set of things that need to get done. The second is that we've got to scale up the testing. We've got to scale up testing in the hotspots, in areas like the Western Cape, to get to identify people early before they start spreading it to others and before they travel to other parts. And then the third is to reduce the complacency, to address the need for people to wear masks and social distance and so on. So those three elements, I mean, it's not rocket science how to deal with this virus now. We have a very detailed understanding of it. And I think in terms of the way in which the government has articulated the plans to deal with it, we should be able to contain the situation so that it doesn't lead to a national crisis.
We have just passed over 20,000 deaths from COVID-19 now, and that is a very sobering reminder that this illness is taking lives, and it continues to do so. Also a warning from the President that often second waves are more devastating than the first wave. So obviously we've got to take this seriously, but at the same time we have made such progress. As you mentioned, you know, that we're testing so much quicker, the results are coming in quicker, but also therapeutics, working to treat people who are hospitalized. My understanding is that is speeding up as well, because hospital staff know when to intervene, which people to intervene with, and they get them better, quicker. Is that right?
It's absolutely true. And it's not unique to South Africa, by the way. It's across the world. There's a gradual shift in the case fatality rates, and we see it very clearly in South Africa. And a lot of it is about medical personnel and hospital facilities being much better prepared. It's all about that. When the first wave came, we weren't as prepared. But as we got better, as we got more prepared, people understand how to do this. Now we have a much better way of looking at patients, identifying those who need interventions, those who need different kinds of intubation, who would do well with a nasal flow cannula. So we're just getting better at it as medical people. But there's also the issue that people are now also more vigilant, coming in earlier, they're monitoring themselves. So it's an all-round effort that we are seeing improvements in our medical care and lower death rates as a result.
Are you confident that with the international travel now being completely relaxed, obviously with strict protocol, that we can cope with the influx and the testing and the turnaround of testing that might be required?
Yeah, so this announcement from the President is in keeping with advice that we've provided, that if we go the route of ensuring that people coming in have a negative test result, then that poses minimal risk to the country. The problem has been that in some countries you can't get hold of a test, or you may not be able to test. And so to remedy that situation, we've recommended rapid testing at ports of entry with confirmation by PCR, so that even if you don't come in with a test because you're coming in from a country that doesn't have it readily available, you still can come to this country, we can test you and allow you entry. So that gives us a pretty high level of confidence that at most a few people still in the incubation period may get through, but they don't pose any major risk given our overall state of the epidemic. So it's actually a good move on his part.
What message do South Africans need to take here, Prof, especially on some of the amendments to this level 1 regulations, the normal trading hours for alcohol sales? We know the amount of pressure the abuse of alcohol has had on our hospitals. We're going into the holiday season. People will be meeting with their friends. They'll be socializing. The President is appealing that please do it in small groups, avoid large gatherings. But how important is it that South Africans, while they may celebrate that they'll be able to purchase alcohol for extended days and for normal trading hours, but they also need to be very cautious and drink responsibly?
Yeah, I mean, alcohol is a very complicated thing in South Africa. I mean, it's one of the few countries in the world where alcohol plays a major role in our restrictions. In almost no other country that's the case. And I think it relates to the way in which our country has a relationship with alcohol, of abuse, and a way in which we perhaps are not behaving as we should in relation to alcohol. So alcohol in this particular instance, we've had some issues relating to the way in which people are gathering in large numbers in taverns. And so I think changing the opening hours of and sales of alcohol might ease some of that. And in that people will now be able to buy alcohol during the weekends and so on. So I think overall that change in restriction is more for economic benefit. I don't think it's going to have much in the way of adverse health benefit at this point.
All right. Professor Salim Abdul Karim, we really appreciate your time on ENCA this evening.